On behalf of JPAL's Digify Africa team, I'm welcoming you to this webinar on digital identification in Africa, reforms, evidence, and opportunities. My name is Jenny Aker. I'm a professor of development economics at the Tufts University, and I am also the co-chair with Tavneet Suri of JPAL Digify Africa. So the reason we're here today is really to talk about this challenge that with many of us are familiar, which is the fact that 1 billion people worldwide have no form of legal identification. Most of them live in sub-Saharan Africa, and this disproportionately affects women. And the reason that we really care about this is because we know that legal identification can facilitate access to basic government services and systems. It can potentially provide new economic opportunities via access to private sector services, and that it can support governments in their attempts to collect tax revenues and then invest in public goods. What we've seen is that the UN has targeted by 2030, in about 8 years, that everyone has legal identities. And there's also been kind of a rollout of many of these digital identification systems throughout sub-Saharan Africa. If we just look at this map, we see that many countries are already investing in collecting biometric identification through their national ID systems. And despite the fact that we've seen this roll out in many countries throughout sub-Saharan Africa, the challenge is really that there's little rigorous evidence on the impacts of these new ID systems and how we can best leverage them. And so that's really the focus of this webinar today. We're hoping to learn about existing policies and initiatives in the area of digital identification in sub-Saharan Africa, exchange with researchers on the results from existing research, and also challenges and opportunities on doing research on digital identification, and at the same time, try and identify potential areas of future research and collaboration. We have a fantastic set of sessions over the course of the next 2.5 hours. We're going to be starting off listening from the policy perspective in Nigeria, from the World Bank, and from Kenya. And then we're going to be turning to research, kind of learning from what has worked and what hasn't necessarily worked. We're going to engage in some Q&A, and then we're going to kind of talk about potential areas for future research and direction. So before we start off, what I'd really like to do is just briefly talk a little bit about JPAL for those of you who might not necessarily be familiar with this. We're kind of a network of over 255 researchers from different institutions throughout the world. And overall, we work in a broad range of sectors and themes that you can basically see here. And kind of the idea is that digital is cross-cutting in all of these. You can see that there's not necessarily one that just focuses on digital. We know that kind of poverty is something that is complex and persistent throughout many countries, low-income and high-income countries throughout the world. We're focusing in this initiative on sub-Saharan Africa. And our mission is really to work with both the public and private sector partners to address poverty using scientific evidence, in many cases randomized controlled trials. So the specific initiative that is kind of hosting this webinar today is the Digital Identification Finance Initiative in Africa, Digify Africa, that aims to co-generate a body of rigorous evidence on the impact of digital IDs and payments in Africa, and hopefully use this evidence to inform policy. We have collaborators from governments, the private sectors, the NGOs, and multilaterals, and our researchers are JPAL affiliates, invited research, and African scholars. And we focus on several different things: the supply side channels, demand side channels, and the intersection between the two, and then particularly looking at the spillovers of those in the broader economy, the interactions between the supply and the demand side, and the potential impacts on the private sector by investing in digital for payments. But so for many of you who may not necessarily know, we fund a variety of different research projects, proposal development grants. You can see those in yellow here in Ivory Coast, in Nigeria, and Ethiopia. We also fund pilot projects, and then full randomized evaluations in all of these themes. And for those of you who are interested a little bit more and specifically of what we're focusing on, we have a white paper online that you can review. So I'd like to get us started this morning by focusing on the very first session on policy. I'm going to hand it over to my co-chair, Tavneet Suri, who's going to be introducing the different speakers of this session and allow her to take it away. So thank you so much for joining us today. And we look forward to having a really interesting discussion and debate about these over the course of the 2.5 hours. Take it away, Tavneet.
Great, thanks, Jenny. I really appreciate it. Sorry, my video hiccuped for a second, so I apologize for the slight hiccup there. So welcome everyone. As Jenny said, we're going to start off with the policy session, and we're really excited to have a bunch of really amazing people with us this morning to talk about their work and kind of some of the issues in digital IDs. Let me quickly introduce just very briefly the folks speaking in the policy session one by one as we go through their presentations. I think first up is going to be Hadiza, who's the Director of Legal, Regulatory and Compliance Services, the Board Secretary and the Diaspora Project Manager for the NIN enrollment of the National Identity Management Commission in Nigeria. I'm going to try and keep intros short so we can spend more time on presentations and Q&A. So maybe I'll ask Hadiza to take over and start us off. Hadiza?
Okay. Good morning, good afternoon, everyone. As stated, my name is Hadiza. So I'm going to start the presentation. I'm speaking from the National Identity Management Commission, which is an agency of government that is created to establish and manage the National Identity Database. Sorry, I need to start the video. So sorry, today is something else. Okay. So I'm going to share my screen. Thank you. The National Identity Management Project did not start in 2007 with the NIMC. There was an attempt to have an identity scheme, card scheme project in Nigeria, which though successful to a bit, about more than 50 million cards were issued, but the strategy changed in 2006 when the then president decided to have an identity management system. And the concerns then were that there was lack of data for planning for economic development. Planning was made on estimates that are gotten, no concrete data. Then there's no in-depth consumer credit market, because when you are in Nigeria, you pay like you want to buy a vehicle, you pay 100% for it because the consumer credit market was not available. And the committee that started to set up the NIMC realized that was because there was no identity management system in place for even creditors to be able to determine who they are giving loans to. Then there's absence of a uniform system of identification, because of the lack of a centralized identity system, so many different sectors were coming up with their different identity schemes, which resulted in disparate databases. And these databases were silos, not really talking to each other. And then in addition to even the databases, there were multiplicity of identity card schemes across the different agencies and sectors of the economy. So that resulted in huge government expenditure. Annual budgetary allocation to both federal government agencies and the state agencies were huge. So the government has to sit down to see how do we resolve those issues. So the reform initiative of the federal government is for an identity sector is to take a new and complex shape for a scheme and to ensure that the critical infrastructures are in place to ensure economic development. So as I stated earlier, the committee was set up in 2005, and the committee set up to work, and that was how the NIMC came into board. This slide is about the need for identity from birth to death. So there are 5 components of the NIMC legal framework, and one is the issuance of the unique identity number by the NIMC, issuance of the GMPC, identity verification and authentication, harmonization of existing databases, and setting up standards for the identity industry. So the NIMSI Act was an act of parliament passed in 2007 and mandated the NIMSI to do that. So NIMSI commenced operations in 2018, and that was in April 2018. And from then till now, we were able to establish the National Identity Database. The National Identity Database consists of the NIMS infrastructure, which is the National Identity Management System, both what we call the front end, the middleware, and the back end. We try to segment them because of the experience we had in the first ID card issuance. We didn't want to lump the whole project into the hands of one vendor or like a turnkey contract. We wanted to separate it to make sure that Nigeria or Nigerians manage the back-end system 100%. So we have trained personnel. We train our personnel, and they go through regular training and recertification to ensure that they are up to date in managing the database at the back end. Then we have the front end, which comprises of the enrollment component, that is the data collection. So initially, the NIMSI was doing the data collection by itself. We had close to over 1,000 centers location, which was quite inadequate for the size of the population that we have of over 200 million. So I will talk about the ecosystem, because the ecosystem is the process that we had to go to shift from being the collectors, data collectors, management of data, and then being the regulator. So, and then we issue the identity tokens, that's the NIN, which is an 11-digit randomly generated identity token number, and the general multipurpose card, which is a national ID smart card. And then the verification platform also that we have in place is currently being utilized by over 70 licensed companies. These companies include ministries, departments, and agencies of government at the federal level and at the state and local government level. And just recently, just about less than 2 years, we have the mobile platform that we have, whereby we launched the mobile app that also a means by which verification services can be carried out. Then the system, to ensure that we are in tune with international best practices, we have to ensure security of our system and our processes. Security was at the helm of design of the National Identity Management System. So the process is also carried out to ensure the implementation of the project also had to go through different security certifications, such as the ISO and the PCI, because of the card that we issue. Then the PKI also, to ensure that the infrastructure is in place to issue a secure card and to enable digital signature of on the card. Also, the enforcement of the mandatory use of the NIN, which is a requirement under sections 27 of the NIMSI Act to ensure that the NIN is utilized. We came up with regulations, 5 regulations, one of which is the mandatory use of the NIN that detail the transactions that you must produce a NIN as a means of identification. There is also a regulation for the access of to the National Identity Database, which is to guide access by both government, private sector, and the security agencies, etc. Then the ecosystem approach, which I highlighted earlier on, is on the new phase of where we are today. That is enrollment at the front end. We decided to say, since we have government agencies that are currently doing enrollment, and we are currently undergoing harmonization. So we went into a licensing regime whereby we issue licenses to those government agencies to continue capturing data on our standards, send that data, identity data to us, we issue the NIN and send back to them before they continue their functional processes. In the same vein, we license private sector companies that have to go through rigorous licensing program to be able to capture data for us. Currently, we have over 170 private sector enrollment partners, and then almost more than 20 government agencies, and also all the telecommunication service providers also are participating under the ecosystem. So what we do is a process whereby they invest in equipment and personnel. We train the personnel. We have a weekly training program for onboarding new enrollment agents that they have. We train them and we certify them before they go out into throughout the country to do enrollment. So currently we have more than 8,991 enrollment centers spread across the country. And these centers are utilizing over 14,000 enrollment systems. So you can see the improvement from having less than 700 locations with just above 1,000 systems. So, and then in diaspora, we have Nigerians that are living in diaspora. So we went into partnership with some Nigerian companies who are in partnership with some service providers in the diaspora to enroll the Nigerians that are there. So we are active in over 35 countries. We have currently over 20 partners that we are working with worldwide. And lastly, on the harmonization of existing data with MDAs, which is one of our core mandates, and the mandate that was assigned to NIMSI in Nigeria, we are currently harmonizing with the CBN. We have done more than 50% of the CBN record. NIS, that is the Nigerian Immigration Service, also we are harmonizing with them. And they are also enforcing the mandatory use of NIN, because by the directive, no new passport is issued or renewed without identification using the national identification number. So they are connected to, their systems are connected to us to do live verification of a person applying for issuance or reissuance of travel documents. And then we have the mobile network operators also, which is the harmonization that is still ongoing. And it's all the MNOs are licensed by us. They can register persons that are applying for SIM cards through them. They have the license to do the registration using our standards and sending back to us. Road safety also, which is the agency responsible for driver's license and the rest of it. So we are going sector by sector doing that harmonization to ensure that we have a single version of truth in the system. This is what we intend to have by the time we finish the harmonization. Every existing databases where the law is as much as possible trying to prevent the creation of new databases. But for those that are in existence with biometric infrastructure, we harmonize with what they have, and then as agent also they continue to register for us. We allow specific agencies to have their functional registries, but capture of biometrics now is for identity record is exclusively with the National Identity Management System, for criminal databases with the Nigerian Police Force. So that's it on the project where we are, and the vision for the digital identification in Nigeria, which is to ensure that identification is based on NIN number, that it is unique based on biometric. Currently, we capture the 10 fingerprints, we capture the face, and then we have the modality for iris at our back end, but we are about to affect it at the front end. But our ABIS has the modality for iris. Then minimalist record, because initially we were taking over 80 different fields, to register for a person. So we look at the use cases across the world, and we came up with a minimum of 10 mandatory demographics that we capture. And then The name is the foundational identity, which can be provided, which can be verified at any time and everywhere. Then the linkage to a digital civil registration, which is hosted by the Nigerian Population Commission. This is part of the digital identification project in Nigeria, which the next phase in the next 2 years, the civil registration database will be digitalized and then will be linked directly to the national ID database. Then technology, we are vendor neutral. We have experienced vendor lock-in, and we try as much as possible in the design of the system not to. And NIMC also, the DG NIMC also is the chair of the advisory council of the Secure Identity Alliance, which is all geared towards ensuring vendor neutrality in projects, in identity projects. Then our systems are built with legal, technical, and security safeguards in place to ensure data protection and privacy. Even though there's no data protection law in the country, most of the legislations establishing agencies that are into one data capture or the other have data protection and privacy sections imbibed in those legislations. In the NIMC, it is section 26 of the NIMC Act, and then the regulation on the access to the national ID database, which is regulated based on access level and the conditions for which such access can be granted. Likewise, the NDPR, which is being coordinated by the agency called NIDS, is in place. And just recently, last week precisely, there was an announcement on the approval of the setup of a data commission, data protection bureau by the President of the Federal Republic of Nigeria. So that bureau is in the process of taking up, and they are going to work on getting a legal document, a primary legislation on data protection for the country. So what are the challenges that we have experienced during the course of this implementation? You know, the NIMS, the National Identity Management Commission, is a complex design, but we ensure that we had a state-of-the-art technology. And then you look at the vast population we have, the spread, you know, the large demographic of the country, and the difficulty in reaching those nooks and crannies, which we are still experiencing, because those licenses that we currently have are mostly in the urban areas. So soon, when they have finished populating the areas, and since the project is payment on successful NIN generation, they will have no choice but to go back to the hinterland to ensure that they continue in business. And the business model is that the payment for to go to a hinterland, the hinterland or security-prone areas is a bit higher than when you are in the city. So,
Lisa, I'm really sorry to interrupt, but we're out of time, and I want to try and stick to time as much as I can, given we have a limited time for the webinar. So if you can wrap up in the next minute, that would be great.
Thank you, no problem.
I didn't mean to completely cut you off, Adisa. I wanted you to wrap up, but thank you. I appreciate it. I'm hoping some of these issues will also come up in the Q&A as we do Q&A. Let me introduce our next set of speakers, which is a team from the World Bank. We have Tina George, who is a senior public sector specialist and the regional task team leader for West Africa Unique Identification for Regional Integration and Inclusion, the WORRY program at the World Bank. And Julia Clark, who's a senior economist for the World Bank's ID for Identification for Development initiative. So Tina and Julia, welcome. I will hand over to you. I will interrupt to try and keep time, just so that we get through all of our speakers for the day. Just for the audience, a quick thing to mention is please feel free to put Q&A in the Q&A function of the webinar. I will take Q&A at the end and moderate those, but feel free to put them in there. We will definitely come back to Q&A at the end. Great. Julia, Tina, all yours.
Great. Thank you so much, Savneet. So I'm Julia Clark, senior economist with ID4D. I'm going to kick it off and then hand it over to Tina for some more specifics on the WORRI program. So for those who aren't familiar with ID4D, we're a cross-sectoral initiative at the World Bank. So we work with countries specifically to support ID systems that are inclusive and trusted and responsible, and that can support a variety of development outcomes, which you've already heard about many from Hadiza. So we work across three main pillars, which include thought leadership and analytics, so research, country and regional action, so providing financing and technical assistance in over 40 countries, and then global platforms and convening, including global advocacy, convening stakeholders, and developing global public goods. So you can learn more at our website, but I'm also happy to answer any questions afterwards. So sort of coming on from Hadiza's presentation, I think Nigeria is a great example of, the types of projects that the World Bank is supporting. And in this presentation, before Tina gives more of a deep dive into another project, I wanted to sort of highlight, as a program and as an initiative that where, a large piece of our work is focused on research, what we're sort of doing and what our general priorities are, both from a sort of policymaking perspective and a research perspective. So really the big picture, and Jenny hit on most of this in her presentation, so I won't take much time, is that, we know ID ownership and how ID systems are used are strongly linked to access to services and opportunities. And so the potential is really big for reforming these systems and making improvements. And this is particularly the case because we know that disadvantaged groups are the most likely to experience difficulties obtaining an ID and using that ID in practice. And as Jenny also mentioned, the evidence in terms of impact evaluation so far has been quite limited, and what exists shows both sort of the potential benefits of these systems and of key reforms, as well as risks. And I think one key takeaway that I'm sure you'll hear more about in the research section of the presentation is that we've really learned that variation in success, defined as inclusive systems, effective design for development, et cetera, is really down to the details in design choices, in policies, and incentives. And there's really a lot of nuance here, which is one of the reasons why we need so much new research in this area. And so in addition to just, all research everywhere, there's a couple of key priorities that I wanted to highlight just quickly. So one is on, really studying these sort of foundational ID systems, like in Nigeria, like in West Africa that you'll hear about, and this sort of next generation of ID reforms, systems that are designed to follow the principles on identification, as well as, those focused in Africa and East Asia. And this is because of a lot of the evidence that we do have is focused on, smaller pilot systems that aren't necessarily at scale, and are, mostly a lot of the body of evidence is in South Asia. And for impact studies specifically, it's really important, at least from both a global knowledge perspective and a policymaking perspective, to make sure we're capturing, a diverse set of use cases from social protection to financial inclusion and across many of the sectors, again, that Jenny already talked about. But also important is having sort of variety and different combinations of the interventions and treatments that are actually being studied. So, as I'm sure you all know, and much of the research that we've worked on and that we'll hear about today involves biometrics, which is quite important, but is only sort of one aspect of the sort of features and technologies and design of these systems that we know has, important impact. And so it's sort of, one piece of the puzzle, but we really want to broaden sort of in addition to and beyond that in scope. And also, I think a key ingredient, and we hear this a lot from the countries that we work with, is not only longer term impact evaluations, but also shorter, earlier studies that actually, that use RCTs, but also other designs to, identify and be able to correct problems early on, and then test the effectiveness of particular strategies. So in addition to the effect of ID on why development goal, also these sort of earlier studies are really important, and then sort of routinized data collection. So our approach to all of this is three-pronged. So first, we work on developing global data sets and sort of evidence-based resources. The second, which I'm going to talk about for the rest of the presentation, is for the countries where the World Bank is involved in ID projects on designing comprehensive learning and evaluation strategies, as well as providing guidelines and tools to make sure that research is mainstreamed throughout. And then, of course, we work to support additional opportunities in countries that we're not directly involved in, but that can add to the evidence base. And we do this both with internal partnerships. We have a strong partnership with DIME and other units within the World Bank, as well as external partners. And I think a key thing that's really important to us and that we design our work around is that the research should sort of inform the guidance, the technical assistance, the design of ID projects that we support, but then also through those implementation experiences, highlighting new important issues for research as well. So in terms of the sort of country level work and focus that we're doing, and I'll go again very quickly through this and share these slides afterwards. I know I'm talking very quickly, so you'll have them afterwards. But again, we've seen, in many countries that they, have sort of lacked historically a holistic approach to thinking about the data that they'll need throughout the project cycle. And so we work to support them sort of throughout the cycle and on key issues. So if we think about, starting with the planning phase, this is really, the stage when the design of the ID system decisions are made that affect, how it will be used, how inclusive it will be, what technologies will it adopt. And so this is a key area where, there are a lot of inputs needed in terms of data and research to sort of inform that design and make sure it really responds to the needs of people and the government and the private sector. Then, as I just mentioned, during the sort of initial piloting and scale-up phase, either for a new ID system or for a case like Nigeria, where they're undergoing significant reforms, to make sure that it's possible to actually evaluate the technical performance of the system and the processes, but then also, as I mentioned, pilot different operations and strategies and rigorously assess which ones are most effective in achieving, higher enrollment rates, fewer errors, more inclusion, better knowledge of the system, et cetera. And then, of course, having, as a scale up to implementation, having clear monitoring and evaluation systems in place, data dashboards, ways to easily monitor and track and resolve issues that arise. And then again, as I said, in the longer term, building in, rigorous impact evaluations to look at how these specific policies and changes and their link to services impacts the development outcomes that we really care about. And so just a few examples of this strategy in practice. So I'll talk about on the next slide. We're working, for example, to develop a standardized indicator set that countries can use and build into their M&E frameworks and design. We're working with a number of countries, including Ethiopia, Philippines, and then early discussions in Morocco and elsewhere on strategies for evaluating technology performance and procedures, including some initial pilot surveys of registrants in new systems. An area where we really value additional work, and we see a lot of scope, as I said, for scale up, is in testing different options and strategies to really improve implementation and maximize impact. So communications and outreach strategies, what is effective in increasing take-up and knowledge and trust, looking at, as I said, the devil is in the details. So what are the specific, policy and procedural tweaks that can reduce errors and maximize inclusion? And what are, knowledge and other interventions that can boost adoption of the privacy protecting features that we're seeing, more and more countries adopt, but that, people like you and I aren't necessarily using when they have the option. So how to sort of increase that take up. And then again, as always, working on impact evaluations. We've recently completed one in Pakistan, and then we're in the sort of planning and design phase in a number of other countries. So I'll conclude just by walking through 3 examples of these very briefly, and then I'll send you these slides so you can look in more detail. But again, so the first is this set of standardized indicators. One thing we've heard a lot from countries is not only that They may not be thinking about the types of data that the system needs to collect from the beginning in order to, have baseline data on performance, to catch issues early, to understand, errors that are coming up, to measure whether they meet their targets. So A, it's sort of first defining what those indicators are, but then B, making sure that actually it's possible to technically implement that with the system in accordance with data protection practices and needs like encryption. And then second example, Tavneet, yes, well,
that's my signal for your out of time.
I know, yes. So I'll share these slides, and this is sort of examples of surveys we're doing in Ethiopia and elsewhere to really get at people's experiences of the system, and an impact evaluation in Pakistan that's looking at the effect of using biometric verification for cash transfer beneficiaries on women's control of cash and other delivery mechanisms. So again, we're very excited to collaborate with any of you and support in any way. And Tina, I know will give you a great in-depth overview of one such potential project. So thank you.
Thanks, Joya, for that really nice overview. I'm going to share my slides and let's see if you can see them. Okay. Thanks so much, Tavneet and Jenny and Nidhi and everybody, JPAL, for the invitation. I'm joined virtually by Eliana and Ana Lucia as part of the Impact Evaluation team. My name is Tina George, and I'm the Regional Task Team Leader for the WURI program in West Africa. So let me tell you a little bit about the WURI program and the policy, the problem statement from a policy perspective. Some of the issues that we're looking at are really looking at access to basic human development programs in West Africa, which is quite low. And so the question is, how can we deliver social services in a way that eases access without excluding people? Now, we know that access to human development programs, in terms of West Africa, it has the second lowest rank for social safety net coverage, and it has, by contrast, one of the highest mobile money transaction values by the region in 2020. And we also know that access to services and benefits is often difficult and burdensome because of identification barriers. And at the same time, we do know that technological developments have helped, as we can see from these mobile money transactions, but it can also cause additional risks and challenges. Just to give you a sense of, the human capital index, this is typically defined on the basis of survival, expected years of learning adjusted school and health. And from an HCI index perspective, which the World Bank measures, the WURI countries, which are 6 countries in West Africa, they fare quite poorly. So about out of 157 countries, Benin is 127, Burkina Faso is 144, Cote d'Ivoire is 149, and so forth. So that's really the problem that we're dealing with. That is, how do we help deliver social services in a way that eases access without excluding people? So in order to do this, we approached it from a human-centered design approach. And here you can see we did field visits between 2018 and 2020 to about 15 different locations across West Africa. And this was to better understand the context and, to shift the role, the protagonist from the government to the individual, and to understand what people's day-to-day lives were like. The objectives were to understand the identification processes in 6 countries in West Africa, to experience how those processes function in that country context, especially for the poor and vulnerable, and to determine what's the most direct pathway for them to access those services. Let's go to the next, and I'm going to show you what we found. So in terms of in terms of the coverage of identification systems, and I'm going to show you the ecosystem in a little bit. I'm not sure why this is. Do you see this, or?
Yeah, they're now moving. Tina, they weren't moving. They were stuck on the title page, but now they're moving.
I took over on the slides.
Okay, great. Thanks.
Are you on the slides?
That is
are
correct.
You projecting?
Yeah, I'm projecting the slides right now. Yep.
Okay, great. Could Could you go back to the previous slide, please? Super, thank you. So that's the human-centered design approach as I laid out in about 15 locations across West Africa that then leads into this next slide. Now go ahead to the next slide. Thank you. Okay, all right, so let's look at why a foundational unique identifier, and I'm going to be talking about uniqueness. For various reasons, we found that not everybody has access to a government registered, a recognized, or an official identity document, especially of état civil, which is the birth registration, or the carte nationale d'identité, the national ID card, and this is quite low. And because of this design, the credential presents a way to access services, and it's a stepping stone. So we talk of uniqueness and a unique identification as a stepping stone to access services. So from a foundational identification perspective, this takes a human rights approach to be more inclusive of all persons. So we talk about chaque personne vivant, that is all persons physically in the territory of the country, irrespective of nationality, citizenship, or legal status. It's free and frictionless. What that means is it's free to end user. It is zero cost for the individual, but also it needs to minimize the private costs in terms of easing entry and access to identification, and thus facilitating access to services. It should verify your uniqueness and then be minimalistic, as Nigeria, the government of Nigeria just spoke about as well, and issue a government recognized proof of unique identity credential, both in physical as well as in digital form. And it's not a competition, but it's a complement to various other systems and provides that stepping stone, and then protects data and privacy. So you can see the principles or the design attributes which are based on the principles of unique of identification for sustainable development. So let's go to the next slide, please. Thank you. Okay, so this brings us to the pathways to identification. So let me just stop here for a second and tell you about this infographic. And so this is a composite based on the journeys of people who we met across these 15 different locations, and how typically identification, the process of identification is carried out. So if you were born at home, you would then go to a courthouse. You might get a jugement supplétif, which is a judicial order. And then if you're lucky enough to make it to the mairie or the town hall, then you might go get an acte de naissance, extrait de naissance, and so forth. And then you go to the certificate of nationality or the national ID card. So as you can see, this is a pretty long process. If you were lucky enough to be born at a health center or a hospital, you then get a déclaration de naissance, which then leads you to the town hall, the mairie, where you get the acte de naissance, extrait de naissance, and so forth. So you need all of these proofs of documentation in order to then get your national identification. So what the unique identifier does is it does an en masse registration suite, and it provides a direct pathway to access the services by accessing the minimal, asking people to register with minimal data and biometric data. And then it also gives you a pathway to go back and look for go to the town hall and get a late birth certificate by then getting a jugement supplétif from the courthouse and so forth. So there's, I'm simplifying, this infographic really simplifies a lot of the legal background that goes into making these identification documents. Now, can we go to the next slide, please? Okay, so this is the foundational identification ecosystem in West Africa under the Francophone legal system. So you have birth certificates, you have the national ID cards, and then we also have the ECOWAS National Biometric Identity Card, which is regionally recognized. So what the basic unique identifier does, it's issued on a voluntary basis. It's a human rights-based approach. It facilitates access to services, and it just says, this is me, I'm unique, and this is me, and it's a basic pathway that then leads into the rest of the system. Okay, next, please. Next slide. Okay, I'm going to skip through these slides because I am short of time, but how does this foundational unique identifier work? You add the unique identifier along with socioeconomic data, for instance, in terms of a social registry. A social registry helps you determine who is poor and who is vulnerable. So if you're able to determine the uniqueness of individuals and then compose households based on the uniqueness of individuals and then append socioeconomic data to it, we are then able to deliver cash transfers to safety net beneficiaries. If we were to look at universal health coverage, we would use that universal unique identifier to then append that to health data to then deliver services to patients. For a traceability system for agriculture, you would use the unique identifier and so forth. So as you can see, the basic is the unique identifier, the basic platform. Keep going, please, to the next slide. Right. And I am going to skip through this slide in the interest of time, but essentially what that will tell you is that we need to build in dynamism because socioeconomic data is collected on a periodic basis, and in order for that data to be truly dynamic, to be able to be to build shock responsive systems, this is why we need the unique identifier and how the whole systems are architected. Okay, go to the next slide, please. Okay, so now let me tell you about the WURI program. And so the WURI program is a $395 million program across 6 countries in West Africa. It's a multi-phase programmatic approach at the bank. It benefits about 100 million individuals in Benin, Burkina Faso, Cote d'Ivoire, Guinea, Niger, and Togo with support to ECOWAS. Next.
Tina, you were out of time, so if I can ask you to wrap up in the next.
Open research. Do you mind if I at least give you the open research questions, because that's the that's
if you can be super quick, that would be great. Yes,
I will be super quick. I will be super quick. Thank you. Thanks, Stephanie. Thanks. Next slide, please. Let's just go straight to the open research questions. Okay, so our open questions, number one question is, how can we ensure that we're registering the poorest and the vulnerable, whom we call the first mile? For human development, we're not like electricity transmission or infrastructure projects where we think of households as the last mile. The first mile, they're the ones who are most likely to be excluded. And so while the survey data and qualitative research can provide some helpful information, there's not a lot of evidence on strategies as to how to address those areas. And what we are exploring with Tavneet, Jenny, and others is how to respond to these questions by varying the communication strategies, that is varying information, and en masse registration deployment, that is varying distance, etc. So this is really at an early stage in one of the countries. And so we're hoping to provide inputs into the design decisions to see if we can we can influence the increase in take up and service and do an impact evaluation around that sense. So we, from our perspective, we would need to look at what kind of an instrument would we use given the challenges of deploying with a universal coverage program. The second is in terms of increased access and usage of services. There's really a limited number of rigorous impact evaluation studies. Even the study listed over here says children from 0 to 5 years, lack of birth certificates, delayed 1 out of 9 vaccinations. So, there's very limited evidence in this area. And to the next slide, please, which is the last on the open research questions. The last two are, what are the appropriate incentives to boost the demand for authentication services? And Nigeria touched on this as well on the verification services, because once you do the en masse registration, you have a body of people, but then you need to keep it continually sustainable for service providers to be able to demand that. So this goes back to a platform economics approach of you need to onto the platform at the same time. And how do you do that?
I'm really sorry, but I'm going to have to interrupt and stop there because I don't want to take away time from others. I'm sorry to do that, but I'd like to stick to time and also have some time for Q&A at the end. For those who have Q&A, feel free to also upvote Q&A in the Q&A box so that we can kind of ask questions that everybody wants to hear the answers to. So let me move on to our next and last policy speaker, which is Tamara Cook. She's the CEO of Financial Sector Deepening in Kenya, and who we've worked with a lot, and is here to talk a bit about the financial inclusion side. Tamara, welcome.
Thank you, Tavneet. Can you see my screen?
Yes.
Okay.
You can put it in slideshow if you want. It's not in slideshow.
Thanks. Great. So you've heard a lot about the ID systems that are I've pushed slideshow, it has not gone there yet. Okay, great. About ID systems, and I'm not going to talk about the process of IDs in Kenya. What I'm going to talk about is where we are right now, who has IDs and who doesn't. The picture that you can see on the screen is of the national ID that is most widely used in Kenya. Of course, the name, the picture, the picture of the fingerprint is blacked out for data protection reasons, but this is the ID that most people have. It is recorded in a digital database that can be queried by the private sector and the public sector, called the Integrated Population Registration System, to query IDs for government services, for registering SIM cards, for opening bank accounts. In 2019, there was also something called the Huduma number that was launched with biometric registration of most adults in Kenya. However, that system is not fully rolled out yet, so I'm going to focus on the ID that you can see on this screen. And what I'm going to be doing is sharing data from the FinAccess data set, which was launched in 2021 in December. And so it's a very fresh data set, 22,000 households, representative at the county level. It's a data set that we work on with the Central Bank of Kenya, the Kenya National Bureau of Statistics, and we've been doing since 2006. I'll be showing some comparisons between 2019 and 2021. On this slide, you can see that 91% of Kenyans do have a national ID, which is higher than what you've heard from some of the other speakers when you think about the continent of Africa and those without an ID. Much fewer people have passports or alien IDs, which is what I have as a foreigner. And Huduma number, as you can see, is about 20% of the population. When we compare 2019 to 2021, we can see that those without an ID in 2019 was actually 5.7%, and that number has increased, or that percentage has increased to 9% in 2021. In the interest of time, I think I'll keep going. There are two big factors that we think have influenced that increase in the percentage of lack of IDs. The first one is the youth bulge in Kenya. When you look at the 18 to 25-year-old population, the percentage of those people without an ID has increased from 19% to 28% between 2019 and 2021. All the other age groups have actually decreased percentage-wise. At the same time, the percentage of the population that is aged between 18 and 25 has increased. The next slide shows a lot of numbers, but focus on those two orange boxes. What you can see is that not only has the percentage of those between 18 and 25 increased, but the number has dramatically increased from a little under 1 million in 2019 to 2.1 million in 2021. This has implications for youth who have just entered adulthood in accessing government services, in registering SIM cards, and in opening bank accounts, for example. Another factor that, and actually let me just say that one of the things that we expect has had an influence on the youth not being able to get national IDs is that during COVID, a lot of government offices were closed and not opened for new registrations of identity cards. And so we do think that COVID has had an impact. At the same time that in general, the youth population tends to be a bit behind in accessing IDs. We also see that those without IDs are more likely to be rural and more likely to be female. This is very consistent with what has been shared already today. As we look at the livelihoods of those without IDs, we can see that casual workers and dependents are most likely to not have an ID. This is very consistent with an outsized percentage of those being young. They would more likely to be dependents and more likely to work in kind of casual jobs where they get paid on a daily basis as work is available. We also see that across all wealth quintiles in Kenya, there is a decrease in the ID ownership. However, we see that decrease highest in those two lowest wealth quintiles. And this is significant because national IDs are something that are used to help qualify people for social protection payments, which has been mentioned in the past, in the previous presentations. And we know in Kenya, even some of the social protection systems have been prevented from people who've been identified as poor, they qualify to receive social protection, have been unable to because they're unable to get a national ID, which is obviously unfortunate and something that the government is addressing. Lots of data on this slide. Kenya has 47 counties. And what you see here is that the percentage of those without an ID is in that gray bar that goes across the bottom. The counties that are on the left side of this graph are more likely to be in arid and semi-arid lands in the northern part of Kenya, or to be in the poorest counties that have high population density and a very large percentage of a growing youth population. We also wanted to look at what about IDs and phones? And what we can see here is that about half of those without IDs are also without a phone. So not only can they not access government services, identify themselves, they also don't have a phone. Is this correlation? Is this causation? Do they not have a phone because they don't have an ID, so they can't register a SIM card? There's probably some of that, but this is really just a point in time looking at what's happening. We also wanted to look at how do those without IDs interact with the financial sector, which of course is what we're working on, trying to really improve the inclusiveness of the financial system in Kenya. And what you can see here is that those without a national ID, more than half of them are excluded from the formal financial sector. About twice as many are only using one financial product rather than a multitude of or a portfolio of financial services. And so this brings concerns, and it just points to that those without IDs are more likely to be disadvantaged in multiple ways, not just lacking an ID. The last slide that I want to show is just looking at the concept of financial health and how that correlates with having an ID or not. What we see, for those of you not familiar with financial health, it is a measure of whether someone is able to manage day-to-day, deal with risk, and invest in the future. In Kenya, we have seen the financial health, even though financial inclusion is very high at 83, I think 0.7%, we've seen financial health continue to decline in difficult situations. And what you see here is that those with an ID are half as likely to be financially healthy as those who don't. So I know we're running behind on time, so I rushed through those. Happy to answer questions later about the situation in Kenya and what FinAccess can show us about that.
You didn't need to rush as much as you rushed tomorrow. But thank you for that really cool presentation. It's nice to see kind of systematic data, especially on younger people, given what's been happening over the last few years. So thank you for that. I think what we're going to do now is switch to the research presentations, of which we have 3 researchers kind of talking about their work on ID. We're going to start off with Sandeep Sukhtankar, who's an associate professor of economics and co-director of UVA CLEAR, the Corruption Lab for Ethics, Accountability, and Rule of Law at the University of Virginia. He's going to talk about biometric authentication in India's welfare programs. Sandeep, I'm going to hand over to you. Just for the audience, hang in there in Q&A. Please feel free to put in Q&A. We're going to try and run a big, massive joint Q&A at the end. So hang in there. Sandeep, it's all yours.
Great. Thank you so much, Tavneet. And thanks everyone for being here, and as well as all the other presenters for the really interesting presentations. I assume everyone can see my screen since we checked this. But what I want to talk about is work on biometric authentication in India, which my co-authors, Paul, Nihaus, Karthik, Muralidharan, and I have worked on for nearly 12 years now. So thankfully, I think that my first slide has already been covered by everybody else. So I'm just literally going to skip this. I'm glad that everybody's on the same page about the importance of identity as rights. But if you're wondering if everybody considers these as so important, what is the potential debate here about why are some people let's say, against some of these types of systems? We've seen the sort of positive case for, and we've seen in the presentations before that everybody is actually really concerned about making sure that vulnerable populations don't get excluded. And therein you can see the sort of debate, right? So everybody believes that if implemented well, you can really use ID systems to change governance, to deliver social services better, to deliver health services better, and reduce sort of the fraud, the corruption and leakage that we all know exists. in many of the countries that we are all working in. But at the same time, we want to make sure that people, especially the vulnerable, are then not excluded if you are delivering these government services using these ID systems. So our goal, of course, we know that there are these trade-offs. Our goal is to identify the extent to which these trade-offs exist, try and figure out what design features can improve it. As I think a number of people mentioned that the devil is in the details. So it's obviously important to figure out these details. So what I'm going to try and do is lay out a sort of very simple framework for trying to illuminate what are the big sort of issues here. And then I'm going to provide some evidence from India's Aadhaar, which is its unique biometric ID, and try and provide some sort of lessons that we've learned that may be of use to countries that are just trying to implement these systems or are sort of along the very nice circle that Julia showed, are somewhere along those different points in that circle. So the framework is very simple. We take as our starting point this idea, a case where the government wants to transfer some value, whether it's cash, whether it's some goods, whether it's services, to select beneficiaries via an intermediary. So this is sort of the standard case. So you can think of the government is sending food assistance, food aid, the government is providing health services, the government is providing educational services. There's some value there that the government wants, and it wants to make sure that select beneficiaries get it. So only people who are eligible are getting this benefit. Okay, so in order to do this correctly, the government first needs to test eligibility. So for example, if your eligibility criterion is people below a certain poverty line, you're poor, or people who live in certain areas, or people who otherwise qualify by age or community status, whatever else it is, you need to check whether someone is eligible or not. And then the second is to actually, once you've determined eligibility, is to test identity. So authenticate that the person who's come up to claim those benefits is actually who they claim they are. Okay, so that's the sort of second step. And then the third step, which sometimes people think is just implicit, is the government must actually authorize that transfer. Okay, so this could just be in real time if you're just getting cash, or if you're or something like that, or it could be in advance. So you are sending food ahead of time, and then you will reconcile how much food has been given out later on with this sort of advance and lag checking system. Okay, so these are sort of the three steps in this broad transfer problem. Now, how can biometric digital IDs help or not within the system? So they can actually play two roles. So first is what we've already just talked about. Just confirm that this claimant is real. It's not a ghost, as probably most people are aware of what a ghost is, but just for everyone's benefit, a ghost claimant is somebody who is not real, but on whose behalf benefits are claimed. And this is a huge problem for corruption. Lots of sort of benefits go to fake people or these ghosts. So biometric digital IDs can really help with that to ensure, because ghosts don't have fingerprints, ghosts don't have irises. So you can confirm that this person is indeed real. And then the second really important thing is that it can provide these links between interactions. Okay, so you can now confirm that this is the actual claimant who was previously deemed eligible. So this is sort of across time, and it's important as well in cases where you want to make sure that the benefit is maybe quantity restricted and the same person is not claiming benefits twice. Okay, so this can also be an issue. So for example, in some work we did on India's NREGA, which is the workfare program, lots of supposed work was done by the same people many times. But of course, that was not true. And so this is the kind of thing that you can check, provide this kind of link across time between interactions. Okay, but what is really important to note, and this is something that perhaps sometimes the sort of most ardent proponents of biometric ID systems forget, is that per se, the biometric system is not necessarily going to improve your eligibility test. If your eligibility test is based on whether someone is poor or not, the ID by itself is not going to help you determine that. And what is really important in practice is, of course, by itself, the ID is not going to, let's say, prevent the agent that you've charged with providing these benefits from extracting some of those benefits for themselves. So at the point of transaction, a beneficiary comes up and says, hey, give me my food. And the agent says, sure, put your ID here, prove your identity. But now I'm only going to give you 9 kilos instead of the 10 kilos you are eligible for. Take it or leave it. Okay. Obviously, this kind of interaction is not going to be sort of precluded by having a digital ID. Okay. So now that we know what these IDs can or cannot do, we can start thinking about how to balance the benefits and costs, right? So if the benefits are that the biometric IDs can reduce fraud and leakage, one important question you might ask yourself is, are these big issues in your let's say in your specific program, in your specific application in the first place? So for example, are ghosts an important issue? Are there a lot of ghosts who are claiming benefits to begin with? You might get that information, let's say, if you've done a good baseline survey or have some other data from elsewhere. On the other hand, maybe specific identity is not really important, in which case maybe biometric IDs are not such a good idea. So what is an example of that? Let's say you are running an agricultural extension service class. Who exactly comes to that class is not really that important, okay? In that case, it probably doesn't make sense to demand that everybody has to have a biometric ID before they can come to this class. And in case you think that, well, why would anybody do that? I'll tell you that there are lots of random programs like these that for some reason require biometric IDs. The second question then related to the costs are, you can actually have some priors on how big the risks of exclusion or the risks of additional extra transaction costs that beneficiaries have to pay might be. So you can, from the type of population that's served, you can have a good guess of the likely risk of exclusion. Is this population served tend to be elderly, for example, and generally poor? In a lot of the work that we've done and others have done as well, these are the types of populations that tend not to have the right paperwork to get a biometric ID or the ability to go and get a biometric ID in the first place. Okay. So that's one criterion. Another could be sort of what's the benefit and how harmful is it likely to be if it were to be excluded. So for example, if this is food going to the extreme poor, that's a very sort of high bar. You really want to make sure that people are not being excluded from that. Versus, let's say, cooking gas going to people who are generally middle class or rich, the lack of that may not have such an enormously detrimental effect. Okay. And then the next sort of set of questions is the extent to which risks can be mitigated. Can you have offline fallbacks? I'll talk a little bit about that in just a second. And so that is obviously going to be an important question to try and figure out ahead of time. Now that we have our framework, let me quickly talk to you about the setting and then the evidence on Aadhaar. So Aadhaar is India's biometric ID card. A huge number of people already have it. 1.3 billion have been issued. Most people already have some form of ID, but for 8% of people, it's their first sort of ID. It's used now for various types of government and private sector services, especially after a Supreme Court verdict that said that you can require people to have a unique ID card, Aadhaar card, in any sort of transfers from and to government. So if you're getting a social welfare benefit from the government or you're paying taxes, the government can require you to present a unique ID card. But of course, the use is controversial. The government claims that requiring people to have this card leads to lots of fiscal savings because of reduced fraud. And critics point to the number of people who get denied their benefits, as well as have to pay a lot of extra costs to get their benefits. So we did a sort of broad survey. The specifics are maybe less interesting for this group, but the general message is Aadhaar usage is now really ubiquitous. Okay, in India, whether it's getting the card and linking current beneficiaries to this card, for authenticating transactions, for making direct benefit transfers to people's bank accounts. This is used widely, lots of use cases in all states of the country for programs run by over 20 central ministries. Over 1 billion people have used it. And since the case, and since 2017, which was the previous sort of data point in our study, we've actually seen the usage increase. What is not ubiquitous is evidence on Aadhaar. So there's just an unbelievable lack of research. I know other people have already talked about it with respect to other programs where perhaps it's understandable because these programs are just being set up or just being implemented. But Aadhaar's been around now for 12 years at least, and there is just an incredible lack of research. If you just do a Google search, for example, Google Scholar search, you'll find 15 times the number of papers on the workfare program, NREGA. There's only we tried really hard. We found only 8 studies that are based on primary representative data. And of those, only 3 tried to separate out causal impacts. 2 of those we have done. So it's really unfortunate. But as social scientists, economists go where the data is and where the interesting variation is. And unfortunately, because this is sort of everywhere, there's not that variation available. There's missing matched data between what the administration says and what survey records would say. And so that's probably explains the lack of research. Trying to understand the impact of biometric authentication on the sort of 3 big things: leakage, exclusion, and transactions costs. I'm going to quickly go through these 3 actual studies that specifically try to look at the impact of biometric authentication. The first is a study done by Prabhat Barnwal. It's not an RCT, but it's a very nice study nonetheless. And he looks at direct benefit transfers for cooking gas, which was rolled out in six different phases and then stopped. So you can see that provides some nice variation to try and look at the impact. And so initially, when this was introduced, fewer people started getting the cooking gas. Once it was stopped, it went back to the initial levels. So that could suggest that people who were previously getting it were getting it illegitimately, and there was some corruption there. It could also suggest that after biometric IDs were introduced, a lot of people got excluded. There's some very good evidence to suggest that indeed there was some corruption and some diversion, and this is what makes this a very nice paper. So Prabhat actually goes and measures black market prices of cooking gas to see whether those change once the program has sort of stopped. And he finds that that's actually indeed true. So that does suggest that there was some of this diversion of cooking gas from households to let's say restaurants, but we don't know the extent to which there was exclusion, because it could well be that some households were not able to get this cooking gas because they didn't have the Aadhaar or couldn't access the benefit transfers that went into their bank accounts. Okay, so without that sort of directly matched data, it's really, really hard to know to what extent the drop in the disbursals of cooking gas, the drop in the sales or purchases was due to less corruption or less access. Okay, so moving quickly now to the two experiments that my co-authors and I have done. What we are talking about is integrating these biometric authentication in the two largest social welfare programs in India. We're doing these experiments at scale as is, with the government implementing. So these are not small pilots. These are very large studies in two large states where we signed an MOU with the government for randomizing the rollout of the integration of biometric authentication to receive benefits for these programs. And so, and after that, we're going to evaluate based on the experiment using this kind of matched administrative data with original and representative survey data. Tavneet, how am I on time? Because my phone has gone off.
You have 1.5 minutes.
Okay, so so basically these are two experiments, large scale. The differences are the forms of biometric authentication and the programs they were used for. So one was for the public works program where you get cash for working. The other is for the public distribution system where you get food transfers based on priorly determined eligibility. Okay. So what happened when biometric authentication was introduced in these two programs? In the first case, for the workfare program in Andhra Pradesh, things looked really great overall. People got more cash, corruption declined. In fact, more people started working on the program, which makes a lot of sense. If you're getting more money now, you're going to want to work on it. And their transactions cost dropped too. So the time they took to get their cash actually went down. Meanwhile, in the other state, in Jharkhand, for the public distribution system for getting food, it was a sort of two-stage introduction. In the first stage, really nothing happened. But when they sort of really cracked down, first, people got less food. The government sent out less food. So actually, in the second stage, there was a reduction in leakage, but access went down dramatically. So exclusion increased dramatically and transaction costs increased dramatically. So why are there these two different sets of results in two roughly similar programs, maybe not similar settings? So you might have thought that, well, look, they're two different states, that they're implemented differently, but the state capacity didn't really matter. In fact, in the state where things were not so good, they actually did a better job with implementing. The number of transactions that were authenticated were actually higher. And this whole issue about, well, there's different forms, one as online, one as offline, that doesn't really matter. Within state, there was no difference in the mode of authentication. But as everyone has been pointing out, the sort of small differences in design and the protocols are really, really important. So for example, there in Andhra Pradesh, they use a lot of these offline override mechanisms. Okay, you don't have your card, you can sign for this. Okay, you can put your fingerprint. This was not quite used in Jharkhand. They use these one-time passwords, but hey, if you're not going to have an ID, it's very likely that you don't even have a phone. Okay. There were small other changes. The person who was delivering the benefits changed in Andhra Pradesh. It did not change in Jharkhand. The location of the delivery changed, got closer to the beneficiary. That had a big impact for beneficiary experience. Okay, so sort of big takeaways and then recommendations. Broadly, although leakage went down in both areas, in Andhra, the benefits were passed on to the beneficiaries. In Jharkhand, the government tried to squeeze the benefits and reap the fiscal savings. Instead, what happened was the agents, the dealers, passed on that cost to the beneficiaries. Okay, so again, technology itself is not the determinant. It's the design details and the protocols that matter. And then finally, the methodological takeaways, I mentioned this already, the match admin to beneficiary data is really important. In both these cases, you could have only looking at the admin data, you could have had completely the wrong takeaway in either direction, which is what's really important. And again, the centrality of representative data is really important. In Andhra, even though nearly everyone, 93 to 96% of people love the program, of course, they found the 3% who didn't. And based on those 3%, the government is almost going to stop this introduction of biometric IDs. In Jharkhand, it was the other way. Activists were claiming you are really hurting people, but the government didn't believe them. They thought that they were doing the selective bringing up of bad cases. Okay, so last slide, final recommendations for people going ahead. I think building in these safeguards against exclusion, especially the online fallback options, is really, really important. For governments, I think focusing on making things better for the beneficiaries is really important. The fiscal savings come in the process, but sort of thinking about fiscal savings to begin with, I think is going to make things worse off everywhere. What's really, really important is getting this real-time measurement of what beneficiaries are actually doing. And for lots of people starting off with these programs now, I think building in evaluation at scale while rolling out is just really, really important, given how there's just so few studies out there. And then finally, incorporating these questions about digital ID in these representative surveys is going to be really important for researchers for answering many of the questions that other people have already brought up in terms of outstanding research questions. Okay.
Sandy, perfect timing. I'm going to cut you off there and try and transition over to Jess so that I don't have to completely interrupt you. Our next speaker on the research side is Jessica Goldberg, who's an associate professor of economics and faculty director of promoting achievement and diversity in economics at the University of Maryland. Jess is going to talk about her work on Malawi. So Jess, take it, go for it.
Great,
Floor is all yours.
All right, thank you very much. So Sandeep and I did not coordinate, but his last takeaway about incorporating national IDs in representative household surveys is really a great jumping off point for the presentation that I'm going to give. Malawi's national ID system is at a much earlier stage than the ID system in India. And so what I'm going to talk about is the challenges in incorporating that ID system in some of the government programs. The National Registration Bureau in Malawi was established in 2016, and there was a very successful initial registration drive that enrolled 9.2 million Malawians between May and November 2017. And those initial registration drives collected biographical and biometric information, including the name, the date of birth, the place of birth, etc., and also collected fingerprints and photographs of enrollees. And then registrants were issued national ID numbers and cards that actually look quite similar to the example you saw on the slide from Kenya. And those cards and registrations expire every 10 years. So they expire on people's 26th, 36th, etc. birthday. birthdays. And the idea of the national IDs is to really use them as foundational IDs for both voter registration and for verification of identity and eligibility for other public and private programs. So what I want to do is talk about what we've learned about the challenges to doing that, to integrating NIDs into other government databases in Malawi. In order to be able to use NIDs to strengthen government programs, it's necessary to be able to link data, to be able to link records between the registry database and the beneficiary roles and records of other government programs. And by forming these linkages, we can do some of the things that Sandeep talked about. So we can check for patterns of take-up or detect fraud or ghost beneficiaries. We can also compare participation and track individuals across programs to understand how the various safety net programs interact to provide people with the range of services that they may need and to understand how those interactions affect people's welfare. But many of these databases were created before the national IDs were issued. So these are databases that are records for programs that predate the registration drive or even the creation of national IDs in Malawi. And so these databases tend to use name and birth date and village of residence as their primary identifiers. They do not include NID information. And what we have learned is that it is truly essential to collect NID data from beneficiaries at the time of enrollment or re-enrollment, or really the kind of first opportunity to interact with beneficiaries after they should have received their ID information. Other methods for adding NID information to existing databases have serious limitations, and I'll walk you through what we have learned about some of those limitations. So there are a couple of key challenges. The first really has to do with the nitty-gritty of data quality. And this pertains to the data quality in the registry data, as well as in the data that come from programs and other government records. So we find errors in data entry and incomplete data that really limit our ability to link records across databases and learn about coverage and program participation. Errors in data entry include things as simple as inconsistent formatting, especially of dates, typographic errors, so incorrect spellings of names, numbers appearing where there should be letters, or letters appearing where there should be numbers, and out of range values, so ages, for example, that are impossibly high or impossibly low. And then incomplete data, simply missing fields of information. So here's some examples of what we're talking about. These examples come from the National Registry data and include records from various districts in Malawi. And so what you can see here are a couple of things. One is that the format for date of birth is different in different districts. That can be corrected, but it has to be corrected. A second thing is that you can see a lot of cases where the birth date is January 1st, 1900. And so that's clearly being used as a place filler when someone's date of birth wasn't available. And best practices in data entry, setting aside whether we can get a more accurate record of someone's birth date at the time of registration, best practices in data entry wouldn't allow us to enter a birth date of, for example, 1884. No one who was born in 1884 is registering for an ID in 2017. And so some of these problems are things that could actually best be addressed at the point of registration through limitations placed by the data entry program, through data checks that don't allow an out of range value to be entered. And that's going to be the best way to improve the data quality for things like this. Other challenges that we see are really as simple as typos. So these records have been anonymized. The names that we're using here are not the real names of participants, and we've scrambled some information in the date of birth. But what I want to show you here is that this contains the ID as recorded in the NRB, which is the National Registry data, and then in another data set, the Universal Beneficiary Registry that I'll talk about in just a moment. But what we see here is that in the NID, we have TGER0Q4H. In the UBR, we have everything the same except the 0 has been replaced with the letter O. And that comes up we have other cases where IDs are just sort of one digit off. So here the typo isn't replacing a 0 with a letter, it's replacing the letter E with the letter W, or vice versa. And so these are the challenges that you see when ID information is entered by hand by different people at different times. And of course, if you're trying to compare records, it's very hard to detect that these two IDs are probably the same person. And so again, a system that requires verification, that kind of you enter an ID and then you have to either double enter it, or the system itself is able to query a database and confirm, or request that the data entry clerk enter a new name, will go a long way towards resolving these types of errors and improving the integrity and quality of the data. The reason that this is important is that these sorts of errors make it very difficult to use national IDs to understand the patterns of benefit receipt. So in order to illustrate that, I'll explain the challenges that we faced trying to match data from the National Registration Bureau and the Universal Beneficiary Registry. The Universal Beneficiary Registry is designed to collect data on the poorest households in Malawi, and it's intended to be a two-way system. So a system through which communities identify the poorest households living in their community, and information is collected from those households and fed up into the systems as a way of locating and identifying people who may be candidates for targeting with a variety of social protection programs. It's also meant to pull information from the roles of those programs, to take information about people who are already benefiting from the programs and feed that into the same database. The programs involved include the Social Cash Transfer Program, the Public Works Program, the School Feeding Program, Village Savings and Loan Associations, government-sponsored microfinance programs, and the Large Farm Input Subsidy Program. The identification of poor households and data collection began in 2017. So you'll note at the same time as the rollout of the national IDs began, but the UBR collected information on name, date of birth, village of residence, and phone number. It did not collect NID information. Now, of course, many people had not completed the registration process at the time that the UBR surveys began, but only 28% of the NID records include, only 28% of the UBR records include the beneficiary's national ID. And that includes 24% for men, 32% for women. So what we wanted to know was, using sophisticated statistical matching procedures, is it possible to go back and add NIDs to the UBR data so that we can look for ghost beneficiaries and so that we can check for the patterns of benefit receipt in the population? And what we find is that it's very hard to do. So these maps show you that the first source of variation is simply in the collection of NID data when UBR information was collected in the first place. So the map on the left shows you that only a handful of districts actually attempted to collect NID information. Districts in gray are districts where we don't have UBR data. The districts that are tan are districts where no NID data were collected at all. And then in these remaining 4 districts, in Nsanje, Balaka, Salima, and Chitifa, we have NID information for only some respondents. When we do have NID information, it is of decent quality. So in those 4 districts, for the people who provided an NID, we are able to find their NID in the National Registry data, usually about 80% of the time. So the NIDs that people provide are valid most of the time, though there are important cases of mismatches and imperfections. What we do is we try to improve the match rate by going to the NRB data and saying, can we identify people who appear in the UBR and find their match in the NRD data on the basis of other variables? So in particular, for each person in the Universal Beneficiary Registry, we look for someone in the NRB who lives in the same district, is of the same gender, and has the same first and last name and birth date. But as I showed you, that is a very challenging proposition because of spelling or typographical errors, data entry errors, and date formatting errors. So the first step is to try to improve the data quality simply through data cleaning, correcting, fixing the formatting and standardizing the formatting of birth dates, making simple corrections, replacing letters where we know that a number seems to have been substituted in a place where only a letter should have been allowed, and vice versa. And that's fairly straightforward, but it only resolves a very small fraction of the matches. So then the second thing that we do is we use a match algorithm that allows for fuzzy matches. The specific algorithm that we use is included in the statistical analysis package Stata. It's called RecLink2. And what it does is it searches through the data using the criteria we've provided and finds the closest possible match. It doesn't require an exact match, but instead provides the closest possible match and then gives us a score where 100% is a perfect match. So someone matches exactly on the first and last name and the birth date, and a score of 0 is a match of, it doesn't match at all. What we find is that scores below 60% are very unlikely to be the same person. So as I told you, only 28% of the original UBR records included a valid national ID number. Of those, almost 94% had a perfect match to somebody in the National Bureau of Registration data, and another 3.2 matched to someone who had the exact same name and whose NID in the UBR was within 1 or 2 characters of the NID of the person with the identical name in the registry data. So we think that that person is probably the same person, and there was just a typo or data entry error in the UBR data. So we are able to use these cases of people who appear with NIDs in the UBR to test or validate the fuzzy match algorithm. And in particular, we find that if this algorithm tells us that the match score is 90 or higher, then 98% of those UBR entries have an NID match that is off by only 1 or 2 characters. And the match quality remains acceptable for scores of 80 to 90. So this makes us confident that the fuzzy match is accurate when it tells us that it is able to find someone with a high score. So the question is, how frequently can it actually find someone with a high score? And the answer is that we are able to recover the NID for another 19% of beneficiaries in the UBR. The success rate is highest in the districts that attempted to collect NID records. So in the 4 districts that had NID records for some respondents. In those districts, the birth date data is of higher quality. We were also more likely to have NIDs in the original beneficiary data for women than men. And we are more likely to recover NIDs when they are missing for women than men. This is likely, so this seems to be coming from the birth date. The birth date is more likely to match for women than men. And we suspect that that is because the primary respondents to the UBR survey were women who were able to report their own birth date more accurately than the birth dates of men in their households. Women, Tavneet, are you?
I think you're out of time, Jess.
Okay, well, so let me show you where we start. So here's where we started, right? We started out with 28% of UBR records having an NID. We were able to get up to only 57%. So there's an improvement, but a long way to go. And what we take away from this is that there's just no substitute for collecting the NID data at the point of enrollment or re-enrollment. Other methods of trying to add the NID or backfill it to records are going to be unsatisfactory. Thanks.
Thanks, Jess. We have one more speaker. I'd just like to say, hopefully everybody will hang on for Q&A. There's lots of fun questions which we'd like to discuss at the end of this. Ed will be our last speaker. And at the end of that, if there's folks who are African scholars interested in funding opportunities for African scholars, there'll be a short session at the end on that window. Ed, I think the floor is yours. Our last speaker is Edward Asedu, who's a lecturer at the University of Ghana Business School. He's also an affiliate research fellow in the Department of Economics at the University of Passau in Germany. And he's going to talk about national IDs in Ghana and informal pensions. Ed, go for it.
All right, so thanks so much. My name is Edward, as has been mentioned. I'm a development economist, and I'm working on RCTs to kind of limit the gap between the rich and the poor. On this particular project, we're thinking about how the national identification system in Ghana can lead to or nudge people in the informal sector to contribute towards pensions. I think some of the presentations have shown that there is a gap when it comes to evaluating identification systems in developing countries. So this is kind of a chance to do that. So that's what we aim to do here. I will also pick up from where Jessica ended by saying that you can already see that linking the data is a challenge. And so I also advise that if you're thinking about an RCT in that area, you probably have to take your time in designing, and it's possible that you may have to revise it. So I'll just quickly motivate it, but a lot of the motivations have been highlighted. But what I want to emphasize the fact that we had original treatments, and from a detailed qualitative study we did, we had to revise the treatment. So the ID system developing countries are evolving so rapidly that as you are designing interventions, things may be changing. When we started, we were concerned that a lot of people didn't have ID, and then somewhere in the middle, government enforced that people have it, otherwise you can't get services. So then you have to rethink your design. I'll go through some of them quickly. So I'll not go so much into the overall motivation. A lot of people, individuals 60 years and over in sub-Saharan have increased over time, but a lot of them do not have proper coverage when it comes to pensions, which is a big problem, and which will then affect the well-being of such people in their old age. So it's important that we begin to do something about that. So in most sub-Saharan African countries, however, the coverage of pension plans in the region is limited to a very small section of the population that is in the formal sectors. In Ghana specifically, over 85% of workers are engaged in the informal sector, with a large proportion being female. So you can see a huge inequality when it comes to coverage for pensions. Okay. According to the Ghana National Pensions Regulatory Authority, NPRA, only 1% of these workers contribute to any form of pension scheme. So the issue that we are trying to address here is a big one. There is an acknowledged difficulty in simply extending convention. How do we extend this conventional pension scheme to the informal sector, given some of the challenges? And so you're having challenges on the the identification side, but also with the issue of trying to get these people on. Okay. They do not have access to pension plans managed by employees. They often lack official registration. They don't have ID cards. Also, as the ID card system begins to improve, can we then evaluate what the benefits are for this population? So they often change jobs, and they may live and work in rural areas where financial infrastructure is quite weak. So how can we leverage that? So they may also belong to a very low income and poor education group. So their understanding of the importance of even saving for their retirement is very low. So how do we try to overcome some of these things? We say that the innovation solution, okay, backed by technology, now you can do mobile pensions. People can contribute towards their pensions using mobile platforms. So that has led to an increase in coverage for a lot of people. Even though their contributions are very small, it gives people the opportunity to save. And that is very common in Ghana now after the tier 3 pensions, where people could save with tier 3 pension companies. And a lot of them have come up with platforms where you can pay by mobile money. So we try to leverage on that using the digital identification and seeing how the benefits the digital identification can nudge more contributions on the mobile platforms. So here we do this in partnership with a company, we call that the United Pension Trust. It's a tier 3 company, and they were very good to us to allow us to do this. So members, people subscribe to voluntary contributions via their mobile money account, so you can contribute towards your mobile. You sign up on the phone, and then you can contribute. It can be daily contributions. Some are doing 1 CD, 5 CDs, 10 CDs, or you can do weekly, monthly. So there's that flexibility. So registration is embedded. You dial *170, and then you can do that. And they have some educational flyers for that. So currently, the big problem here is that close to over 350 people in the informal sector have signed up some point in the past 5 years. However, there is huge level of non-contribution in this population. And simply for them to skip contribution, they just don't put money on the platform because they think the platform will deduct. However, on top of that, there is actually a flexibility component that allows you to skip contribution if you don't want to contribute in a particular week. So there's no need not to put money on your wallet. So it's very common in Ghana to tell somebody you want to send money to the person say, hey, don't send it to me because people will deduct, right? But there's actually a tool for you to skip contribution. A major challenge, therefore, is ensuring members sustain contributions to their pension plan. So that is how being regular, not skipping contribution, increasing contribution. So these are all flexibilities embedded in the system. But I would say that before we started, or before our qualitative, some of these nuances were not so clear. So I will in the next few slides talk about old treatment and then how it has changed. Okay, so our specific questions are, does the use of a national ID card as an added security layer induce trust in the informal sector, which then we can measure the contributions, okay? And as training of right now, this is our specific research question, does training on the flexibility embedded in the pension product induce higher contribution? Before that, it was the last objective was actually reminding people to contribute towards pension. But after the qualitative, we realized that just reminding people without training them, because we went to the field for qualitative, and a lot of people, we need to just train them, dial this, and then they realize, oh, I could actually have more control over my contribution. So these objectives have been modified based also on input from some mentors. So generally the intervention, we look at the regularity of contributions, skipping payments, and reducing the number of inactive members. The frequency of missed payments will be observed. So this is the pilot stage. We hope that we can measure more outcomes in the full RCT that we do. So this is our original treatment, as I mentioned, the use of national ID card, linking the pension data with the national ID data, and knowing that has been linked, how does that drive trust and then drive these contribution outcomes? And the second one, as I said, is just the voice message to remind fund members, one about the flexibilities, or reminding them to renew without actually taking them through the process. Okay, so we have control, but a combined one will be done in an RCT. So let me just run through. I will say that a qualitative survey in this setting is very important. Don't rush the treatment quickly or the RCT because there are a lot of nuances that you have to take into consideration. So we did quite an intensive qualitative survey, and in a number of cases, respondents showed a preference for the Ghana card. Okay. A respondent explained that because of fraud, adding an ID card will secure contributions, blah, 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 and they are confident enough to continue to contribute. So we got that. In about 50% of respondents also stated that the use of the national ID card will indeed increase trust. So in terms of the numbers associated with the issue here is that before the Ghana card or before our study, all that the pension company has is their mobile phone numbers. That is the unique ID that they have. They have no other unique ID. So this linkage probably is very important. And in general, respondents did not demonstrate an appreciable level of familiarity with the flexibilities features that the pension product offered. They had no clue. So we need to change the treatment a little bit. Less than a quarter of respondents were aware that they could make even voluntary contribution. There's a component that you work today, you get some lump sum money, you can go on a platform and add some money to it. They have no clue. If they set up for 1 Ghana cedis, that's all, or they just skip payments. So that is what we have. While almost all respondents were aware that they could include a next of kin, none of them know how to do that. So you could actually change the next of kin on your phone without calling anybody, which is very important. It gives them confidence in the system. So after we just changed it to making salient the use of the national ID card, and here the idea is to, initially the idea was to take the phone numbers from the national ID authority, NIA, and then we randomize within that sample, but they are still at the collection stage. And as Jessica said, even when you have that data, you need to put in mechanism to double check the quality of that data. So we will do that by calling the people for the pilot, calling the people to check, to collect this number for the pension company. So work together with the pension company to collect it from source. Once the national ID authorities data is ready through the mobile platform, we will compare the quality between the two. So we've drafted a message that we will use to get the national ID card, but I'm just showing you this just to make sure that, to let you know that we try to make these two messages comparable. The one for treatment one, which is just the national ID card, and that of the training and reminding subscribers on the flexibility. This is something that we've been working on, trying to shorten it. And not just shorten it in English, but shorten it in the local language, which has been very tricky to do. But yeah, we've tried to do that. So what we would do is that the first call, or they will get a voice message saying that I'm calling you from the pension company. I first want to thank you for contributing to your pension. Please remember that once you have signed up, there are things that you can change regarding your MOP. You can increase, decrease, We will call you another day to train you on these flexibilities. So there will be a second hand, which we are trying to make sure that training and then collecting of the pension, the Ghana card information, that information is also balanced. So that's what we have to do. And on top of that, as I said, design challenges, the government keeps changing stuff. As I speak now, there is a SIM card registration going on, and you need a Ghana card to register that. So the data, in fact, should go to the provider, which is MTN. And later on, then the pension company can sign some agreements with MTN to get the data in. So the question for the pension company is whether to rely on the data or for their subscribers build a database on its own. And that is what we are doing. The latter, trying to collect the data, and once it comes in, but it will all influence the way we collect it. If the data from the national ID, the Ghana card is good enough, then we can just call subscribers and remind them of the fact that now their Ghana card information has been added, instead of collecting the Ghana card. If that is done and is clean, which we will check with the data that we're collecting from the pilot. Okay. So this has implication for the design. So please take your time when you're designing some of these things. All right. So just trying to wrap up, we have already piloted the messages to make sure they are balanced. And now we are going to full scale assignment of the treatment to the control group. And then we have our qualitative baseline report, which is informing the final treatment that we have gone through. But as I said, the policy environment keeps changing, so we need to always keep an eye on the policy environment as we design these interventions. All right, so I hope I did well on the time. Thanks so much.
You did great. Right on time, Ed, thank you. And if you stop sharing screen, I can ask everybody else to join us for some Q&A. I think we should jump into some Q&A because there's a bunch of questions and it's been kind of quiet. So since Tamara's already on video, let me jump in with Tamara because there's a question for you in the Q&A. So Tamara, someone's asking, Lisa asks, given Huduma number was challenged in court, how skeptical are Kenyans towards the digital ID system in general? And do you think this is one of the concerns for younger people or maybe for older people?
Sure, no, it's an important question. I think something that we've heard throughout all of the presentations is how important trust is. And ID is not only a way of saying, as a government, we trust you. It's also as the citizen saying, I trust this because it's going to get me the services I need. It's going to enable me to do things I care about. And so I think the fact that the Huduma number has been tried in court has created some mistrust or a lack of clarity and uncertainty. I hesitate to, I'm not from the government. I will not make a statement about, kind of where things are. But I think what we can see in the FinAccess data, for example, is that it's had an impact on the youth trusting that, registering for it, going for it. And I think we've also seen that same issue of trust in financial services. We actually see a growing amount of distrust between people and their financial service providers. And so I think that all of these things are kind of wrapped together, and we'll see what happens this year.
Great, thanks, Tamara. Khadija, maybe I can jump to you. This has been a common question, I think, from a few other people more broadly than this, but let's start with West Africa and whether there's, coordination across ECOWAS or by other countries and how you think of that with respect to digital IDs, or do you think it's kind of, within sort of Nigeria at the moment?
I think there's really no formal coordination, but we always meet at forums annually, and we always meet to share experiences among African countries, ID for Africa, for example. But we have had a lot of requests from other African countries coming to examine what we are doing. They come to check our systems. We discuss with them on the design of the system and the kind of legal and regulatory framework we are having in place. ECOWAS-wise, the Nigerian Immigration Service, which is responsible for migration and other things, at least through that immigration service, we have had recourse to start discussion with ECOWAS. Yes, because there's
awesome
ECOWAS ID in the pipeline, but Nigeria is already way ahead because we have all the requirements for ECOWAS ID. We're already implementing that, and our card specifically was designed to work within the ECOWAS because the national ID card design is both identity card, payment, and then also for travel within the ECOWAS region.
Great, thanks, Khadija. Tina, did you want to add something?
Yes, thank you. So we have a grant out to the ECOWAS Commission as part of the WURI program, and the ECOWAS Commission is committed to building in a regional coordination mechanism amongst the ECOWAS countries. Right now, it's just 6 countries, so Benin, Burkina Faso, Cote d'Ivoire, Guinea, Niger, and Togo. And the Commission is coordinating, and we have a regional coordination group going on data standards amongst the 6 countries to make sure that those unique identifiers are portable across borders. And speaking of the last presentation, these social insurance contributions, for instance, can be made by seasonal workers. When they go over to some of those other countries, they contribute back. So we do have a coordination mechanism that's started up. It's in very early stages with ECOWAS and amongst the 6 countries that are operating. It would be fantastic to find opportunities to collaborate more closely with Nigeria.
Great, thanks, Tina. I appreciate that. I think there's also a question about kind of some, and maybe Julia, I know you answered this a bit, but it would be nice to hear you comment on this, sort of how you think these ID standards or minimum digital ID standards would cut across kind of all the various segments of the populations in some of these countries, including sort of youth, minors, refugees, kind of the most vulnerable parts of populations, especially kind of, you know, ones that might not be citizens. So it'd be great to hear you comment on that.
Sure, thanks so much, Savi. Yeah, so I mean, to answer the question, there's no single binding set of standards, but for the international community, we have the principles on identification. I put the link in the response to the question, which is sort of how, I think we have over 30 endorsers, including UN agencies, World Bank, and many more, on sort of what we would expect to see in an ID system that is designed to facilitate development goals. And a big portion of that is around inclusion and around essentially rethinking and redesigning many of these systems from the way that they existed in the past to really put people at the center, put them in control of their data, protect their privacy and rights, and build systems that can serve as platforms to facilitate easier identity verification in person and online. And so that's really the goal. And I think a key point is that there really is no single blueprint. And you've heard a lot today about how, there are so many specifics and nuances that matter for the outcomes that we want to see. And in that same way, there's no, single perfect system that will work in every country. So really having more data and nuanced understanding of what works where and how will help develop sort of a broader portfolio and menu of things that countries can consider as they're designing these systems.
Great, thank you. So there's a question I think that both fits Jess and maybe Sandeep, you can comment on this too, just to drag you kicking and screaming into the conversation. There's a question about whether you need to update kind of the data and how you think about that process. And so Jess, it'd be nice to hear what's been happening in Malawi, and Sandeep, what's been happening in India, as if you get birth dates wrong and all these bits and pieces wrong, is there a way to kind of systematically update the data? Should you not?
Yeah, so I think there's two things. The first is that updating the data, especially at the time of re-enrollment or in terms of programs where people interact with the program annually, adding the NID at the time of a scheduled interaction with the beneficiary is the best option for getting the NID system into the data. That requires two things. One, it requires actually creating a field in the database for the NID. And then the second thing is that it requires a plan for doing that. And that has not really been the emphasis in Malawi to date. We hope that the results that we've shown you and that we've shown the government in Malawi will encourage an emphasis on that. There's a second point about re-enrollment that we haven't talked about, and Sandeep may have more to say than me, which is that also the NID data, the registry data, has to be updated periodically and refreshed periodically. And in particular, new adults have to be added to that information going forward.
Yeah, I mean, I think I agree. This is something that it seems like not much attention has been paid to making the editing and re-enrolling process seamless. In fact, I have a personal example. My mom's Aadhaar, the address on her Aadhaar was somehow incorrect, even though she applied and got at the same time as my dad's. and it was a huge pain to get it fixed. And my mom was a very well-educated doctor living in a city where there's every access around you, has these kind of issues. I can only imagine how someone who is not educated and doesn't have all the centers nearby and doesn't have all the documentation to be able to fix errors is going to be facing. And so I think there was a huge push to just get it out. And now that we're at sort of whatever 1.3 billion, I think people need to think a little bit harder about, well, what's the steady state here? How can we make this steady state seamless and better?
Can I add one?
Yeah,
which is just,
absolutely, please do.
Really important to have a plan for being able to update existing records rather than to add a new duplicate record. Because if you create a new duplicate record, you actually have these same challenges of matching and figuring out what is a duplicate. So that's a particularly challenging thing, because when you update the record, you need to really be able to verify that you are updating with valid information rather than overriding previously entered valid information. That's actually a very challenging thing to do, but an important component of maintaining these systems.
Yeah. Hadiza, do you want to jump in? I see you unmute.
Modification is part of ensuring that we have a robust identity management system. So we do allow modification, and what we have seen over the years is demographic modification for names, addresses, and other things are okay, because most of the time it's either change of names due to marital reasons or divorce or other things. And then the most kind of dangerous one is the modification of date of birth. There's no birth registry. So this is a serious issue that we saw, and what we had to do was to go to our governing board to present the cases that were coming to us, and we got an approval at a policy level that, okay, since there's no digital birth registrar that you can reference to for persons or at the older category, for children, it's okay. Below 16, we can always refer to the birth certificate. But for adults above 18, the board have allowed that, okay, a person can come and do modification of date of birth once in their lifetime. And then you have to come and you have to apply for that modification within a certain period of time, within 2 years of the initial registration. And even at that, if you are coming for modification, it has to be within an age range. Either the modification should not be more than reducing 5 years. If you are reducing, because most of the request is to reduce age, because some people didn't realize there was going to be harmonization between the National ID Registry and the personnel records in other in their working institutions. So when the records were being referenced against the National ID database, then that is where you see clearly that people come to National ID database providing their real age while they have reduced their ages in their working place because they don't want to retire early. So we had to take that decision. We allow modification once, less than 5 years. If you are coming to us to say you need to reduce more than 5 years, then it goes through a different set of requirements. There's a detailed investigation wherein we call in the security agencies that will have to carry out detailed investigation as far as going back to your primary education, secondary education, where you were born, the area where you reside from, your place of birth, to do that detailed investigation. So except in exceptional circumstances where that difference is proved, though we have seen for harmonization of record, we have, because there was no standard then, agencies that were carrying out other registration, we have seen that it is difficult harmonizing because most of those databases were not working on a set standard. So issue of date of birth, some of the field officers doing those enrollment just give any date of birth they have for a person. So we have seen an example of somebody that was 59 years of age being given the age of almost 80 years of age. More than 30 years difference. Clearly, you can see that that is a mistake from the person doing the enrollment. So it's a matter we are trying to address the way we are, but once we have the digitalization of the civic registry, then there will have to be a cutoff date where the only source document that you produce will have to be a digital birth certificate coming from the appropriate authority.
Great, thanks, Hadiza. Yeah, I think this is going to be an issue in other countries too, where there aren't birth certificates really in large parts of the countries. Let me shift gears a little, and something came up as a question earlier, which I think was directed to Hadiza, but I think is more broadly directed to kind of the policy group on the call and maybe even the researchers on the call, which is, there's not a ton of evidence on the causal impacts of ID cards and what they can accomplish. Sandeep has done work in India, of course, but in Africa, we don't have a ton of work. And so do you see interesting opportunities for you to partner with researchers to do this? Is there any resources or any sort of suggestions you would have on how researchers who are interested in these questions can get involved? And maybe I'll start with Tamara and then go to Hadiza and then to the World Bank folks.
I don't actually have any ideas. I think it's important. I mean, I guess I could give an example. In Kenya, we have the ability to query IDs, which meant that we could open mobile bank accounts over mobile money. Next door in Tanzania, when they launched the exact same product, they didn't have the ability to query IDs in a digital way, and so they weren't able to do digital know your customer. So that's a specific impact on a product that people did find useful. And so I'm sure if we put our heads together, we could come up with those kinds of examples of how ID or lack of an ID has a real impact and makes a difference in people's lives for better or worse.
Yeah. I think the other issue with some of this is kind of, there is a process for the ID cards like Kenya is going through at the moment. As Hadiza mentioned, there was a process already in Nigeria, but they're still working on the data protection piece. I think, until those pieces are in place, there is maybe a bit of a constraint. Hadiza, you're going to jump in.
Yes, in Nigeria, as much as possible, we're trying to kind of deplete the physical ID card. We are moving into the digital era, and the NIMC, or the federal government, has at least provided platforms by which identities can be owned by individuals in a digital format, and even kind of do the verification. We have even gone to the extent of giving the power to an identity holder to be able to prove his identity anywhere, anytime, using the digital token, both the number and the digital card that a person that is using smartphone will be able to carry with them. And for those not using smartphone, through the USSD code, to be able to confirm their identity token using that channel. But the perception and the mindset of the majority of the population is holding that physical card. Is holding the physical card. And Nigeria started with the general multipurpose card, which is quite expensive. And looking at the economy now, the federal government cannot sustain the first issuance of that card free of charge to everybody. So we are looking at other options to see how do we go back to government, for government to allow us to charge for the first issuance, so that we'll be able to have the resources to procure the card. Mind you, the card and the chip is procured from Europe. We have personalization bureaus here in the country, mostly in Lagos. The NIMC Personalization Bureau is just a pilot one. So if we have to use it to personalize the card, we need to buy equipment, do expansion of the bureau to be able to accommodate the capacity. So looking at the population, we have already captured 74 to date, 74 million to date. We have issued less than 2 million cards. So you can see that the issuance is quite low, and there's a lot to be done on that. Even though as we stand now, the enabling law allow us to charge for such services. So, but we believe that once we issue the digital identity token, which is also printed on a piece of paper, and when you look at what India did, they didn't start with issuing card. They issued the number, and even the number, they don't even have paper, security paper that they print on. You get a link to print, or even they jot down the number for you. But we started with issuing that number on a secure paper. Now we have moved to the extent of redesigning the NIN slip to be able to even do offline verification, because there's a QR code on the NIN slip that you can do offline verification with that.
Yeah, thanks, Adiza. I think the interesting questions then seem to be for Nigeria is how do you get people to take it up, especially since you're doing the back-end linking already with databases. The issue is going to be entirely around how do you promote use and take up, especially amongst the marginal and vulnerable, and even more so because people often want a physical thing, right? I even see that with my family in Kenya. You know, as they all signed up for Huduma number, they're like, well, I don't have anything physical. And I was like, I'm not sure you're going to get anything physical,
even
right?
with the NIN slip we give, the next question you'll see is, you gave me the temporary one. You have not given me the permanent.
Yes.
The plastic card is the permanent. Yeah.
Yeah, there's this kind of notion that we expect something from an ID card, and that's going to make take up much harder. And people might not even believe they have take up, right? I might go get this piece of paper and then suddenly go, well, I don't think this works. It's just, you know, it's not real. So I think those might be a set of questions. The take up questions we thought about, but this also kind of notion of being tied to a physical ID for it to be real is interesting. And I think an important question for researchers. Tina, did you want to jump in?
Yes, I did. I actually wanted to jump in on some of the social protection questions being from the sector, but you know, let me jump in on this where you left off on the take up and access. To me, I think, you know, the issue of the impact evaluations is that we're not in these impact designing it at the point of entry. So for instance, for WURI countries, for the countries that we're operating in West Africa, we're still at a very early stage. And so we're able to have some level of influence into the design decisions that then allows us to develop the design of that instrument for the impact evaluation. And to me, one of the issues is, you know, at what point in the cycle do you get into? You know, just thinking about some of the exogenous variations that we are talking about in the registration sites. How would we determine what, you know, so would we vary distance of the registration site? Would we vary communications? Would we vary information? Would we vary it with, you know, this optimization algorithm that we talked about? So there are so many different things that we would need to consider, but you need to get in at such an early stage that you're too far gone to be able to intervene. I did want to come in on some of the
I'm going to interrupt for 1 second. I'd like to do one more question, and then we're going to run out of time. And there's actually a really neat question in the chat, and I want to call on Ed to answer it, actually, because I haven't heard from Ed yet. Someone's asking if there's any indications from studies, and, you know, Sandeep and Jess, if you want to jump in after Ed, that's fine, that political biases or any biases would disenfranchise some regions or areas in access to ID. And Ed, have you seen any of this in your work at the moment, or is it something that you know, that you're particularly careful about, and how do you think about this piece?
So I'm just speaking from the Ghana point of view, and in the Ghana case, we haven't seen anything like that. I have a study going on vaccine uptake, and there we kind of check the Ghana card that people hold, and in even very remote villages, an enumerator called me today to say that the bridge to a village is broken, but when they managed to get there, they could get an ID. People had IDs. So,
wow.
So I don't see heterogeneity when it comes to registering for the Ghana card, and it's becoming compulsory. I think by July, if I remember correctly, July 31st, if you don't have an ID card, you can't get access to a banking service. And by 31st of March, that is the deadline to register your SIM card, the calling card. So the Ghana card is the foundation for all these things. So you cannot kind of say some regions don't have it or have different differences in terms of enrollment in those areas. So I haven't seen that in the field, even with follow-up surveys. Yeah.
Anyone else on this one? It was a question to all, actually.
Sure. Yeah, I mean, I haven't seen any kind of targeted exclusion. I mean, in India as well, I think that doesn't seem to be a big issue that people have brought up. Although sort of political sensibilities in the design were important, right? So whether you're a government that cares more about fiscal savings versus you're a government that cares a little bit more about the beneficiary experience, that did seem to matter for us, but nothing along the lines of, oh, I'm going to exclude my people who don't vote for me or anything like that.
Yeah.
I'll just add, one thing we do know is that some sorts of biometric information are more difficult to collect from some populations. So particularly, it can be hard to obtain high quality fingerprints from older people or from people who are engaged in certain manual occupations that can actually wear down the readability of their fingerprints. And in some contexts, when photos are required, it's really important to plan carefully to be able to collect photos of women in culturally sensitive ways.
Yeah, it feels like maybe Tina, you can say what your experience is with the start of Worry or with other parts of ID, or maybe Julia, but it seems there is some exclusion based on these sorts of things, just like hard to reach people, the broken bridge people, like Ed mentioned, you know, kind of those sorts of exclusion are almost kind of going to happen. And I think Worry in particular, maybe Tina wants to comment, has been designed to try to reach out to those populations more carefully and with a bit more outreach there because of those. But glad to hear there's not a complete exclusion of people who don't vote for you, Sandeep. Julia.
Thanks, and I know Tina will have specific examples here too, but I just wanted to come in to say that, yes, I think there's a really important difference between on the sort of spectrum of difficulty versus pure exclusion. So from a technological point of view, what Jessica said is exactly right. There are certain people, if you're missing an arm or a hand, you can't give biometrics. But that need not mean in an ideal system that you're actually prevented from getting an ID. There should be policy overrides that allow for exception handling. So it's the cases where those aren't in place, or where, you know, there was a policy failure to give someone an exception when they couldn't authenticate, that should be in place in most cases. So there's sort of multiple steps with regard to biometrics, but other technology failures that have to happen before you get to the exclusion point. And so I think that's a key area of sort of nuance and intervention, is making sure that there are the right policies and the right incentives and monitoring to make sure that that actually happens. But then also, and Tina can talk about, you know, again, in the sort of next generation of ID systems that we're seeing now, and we heard a lot from Hadiza also, is the goal is to ensure inclusion. So it's figuring out what the friction points are, what the specific costs in both direct and indirect people face, and then finding targeted measures to address those in design and then in implementation.
Great. Tina, I'm going to give you the last word on this because we are almost out of time and I want 1 minute at the end to wrap up. So.
Okay, so I'll come at it from the social protection end. You know, from an exclusions perspective, we are most concerned that you know, exactly as the three researchers spoke of, the exclusions of people from receiving social protection programs. So our concern is really more with providing a minimal proof of burden, minimal forms of documentation, minimal level of entry to be able to get something that's very basic. It's a unique identifier. It connotes nothing else than you have that unique identifier for program delivery. So that's really where we're trying to catch the exclusionariness. Thanks.
Great, thanks, Tina. I really appreciate it. I think we only have a minute left, so it's my job to wrap us all up. This has been really great. It's nice to kind of see the combination of research and policy, and of course, clearly important policy questions that are not being answered and important research questions that are not being answered. So for those on the call, loads of work to do. We hope this conversation has inspired you both to reach out to people on the webinar or reach out to us and do work on these issues in sub-Saharan Africa. I want to thank all the speakers very much for spending so much time with us this morning or this afternoon or this evening as I see the dark set in behind tomorrow. We're really grateful for your time and your energy and for being here with us. I also wanted to just give a shout out to the JPAL Digify team for organizing the event. So thank you very much, guys. As we wrap up, there will be an African Scholars optional session hosted by Nids. If you want to talk about where there's funding for ID systems research under Digify, and Nids Park, the director of Digify, will lead that for a half hour. And there's a registration link in the chat for that session if you want to go to that session. And so it's my job just to say big thank you to everybody attending. Thank you to everybody who spoke and the team who organized, and hopefully we will hear from all of you sometime soon, either as partners, collaborators, or funding research. Thanks, everyone. Have a good day.